I always tell families, you can have a horrible weekend, and on Monday you call me and you say, I can't imagine another weekend like that. I'll support your decision to say goodbye.
Welcome to Dog Cancer Answers, where we help you help your dog with cancer.
Dr. Mary Gardner, thanks so much for being with us today. Really appreciate you joining us.
Yeah, no, I'm glad to be here. Thank you.
So my first question for you is, how do we know that we have an old dog? Because I look at my 14-and-a-half-year-old Maltese and I see the puppy.
And it does change depending on the breed, right? So so technically there's some ranges of ages for senior dogs that are dependent on the size. So a Great Dane is senior at 6, where a Maltese might not be senior until 10 or 11. But you know what? It's just a number, Molly. So, are we senior citizens? Who's to say? And right, like, what's that? I don't know. What is the number that humans become senior citizens? And that could vary, because some people say it's 65, some people say 60. The AARP at 47 sent me stuff. Like, they were ready to talk to me. And I'm like,
100%.
So my focus is not necessarily how old they are, but how they are. And so you and I could be maybe 70 years old, right? And we're technically seniors, but we're not geriatric. We're not fragile. We don't have all these problems. And so the senior is really just a number. To me, it's geriatric and how fragile they are and all the aging problems that come with it. So a Maltese, typically the smaller dogs, they do live longer. And that's a whole other topic, right? Of why the Great Dane does not live as long, and we wish they would. But, yes, definitely senior. Don't know if your Maltese is geriatric yet, though.
Great. That's a really great distinction. So what is geriatric then?
Okay, right. So when I was learning about geriatrics, I actually went to a human geriatric conference. So it was for like geriatricians. And I'm like, what is a geriatrician? We have pediatricians and geriatricians. And so like, what is that? What is that? In humans. So I went to one of their conferences, and it was just very interesting because I learned so much from them. And we're not going to do the same thing in our world, but it was just kind of cool. So they, a family doctor, when a human is of a certain age, but having multiple issues like slowed walking, memory, issues, weakness, sleep disturbances, things like that, they will send them to a geriatrician, and they consider them, it's called a fragility syndrome, and they'll send them to a geriatrician to work with. And the geriatricians deal with polypharmacy. So all the specialists and all the doctors are giving them meds, which happens to us too. They're dealing a lot with cognitive dysfunction. So Alzheimer's in humans, and caregiver burden. They help families manage this aging person. What can we do to the house to make sure they're safe? How can we help them at the store and get them what they need? And that is, and so I thought of that with our dogs and cats. And I'm like, okay, what makes a geriatric dog? Because you can have, Molly, a 12-year-old lab that's wagging his tail and everything is great, but he's not doing well. He's not eating, he's cognitive dysfunction at night, panting and pacing. But 3 years earlier, he's a senior at 9, and he's totally fine, chasing balls and running around like crazy. So the concept of geriatric is really about fragility and adverse outcomes. So a stumble to an older dog is way harder on them than a stumble if they're 6, right? So we want to make sure that they're kept safe, and a lot has to do with cognitive dysfunction and some other impairments that they start to have.
Okay. So what would you call normal aging versus like signs of illness that we start to see?
Great question. So there's a lot of people say that old age is not a disease. And I always say, well, disease means dis-ease. They're not doing well. And there's a lot of natural, quote, aging processes that make us not well. So for instance, here's an easy one. We're all getting wrinkles, right? So we all get wrinkles as we get older because the collagen isn't there as much. And it stresses us out when we see it in our 40s and 50s and maybe even our 60s, right? But is that really a problem that we have wrinkles? Well, guess what? When we're in our 80s and we don't have that oil production in our collagen, our skin becomes fragile, right? And if you've ever seen an elderly person, it's bruised and it's fragile and they can't, bumps. So is that a disease, Molly? Right? That
Okay.
is your skin being fragile a disease? So I think there are absolutely diseases, but just as we age and get older, like nuclear sclerosis, a problem with our eyes, that is a disease technically, but it's usually not going to cause complete blindness, but it can bring a lot of struggles. And so there in the human world, they actually would like to make aging a disease because then there's better insurance programs behind it, more research.
You can code for it.
You can code for it. Exactly. You can't code for something that people say is not a disease. But let me tell you, my grandma Gardner, when she was in her 80s, she had a lot of struggles, but did not have a diagnosed disease.
Right.
Besides arthritis. Like that was about it. But which, so many of our pets have.
At what point, Dr. Gardner, do you feel that a dog has gone from being a senior who's doing well to geriatric? Where as a clinician, what are you looking at for when dogs come in? Is it that fragility? Is it the skin problems?
It's the fragility and they may not have skin problems, right? So I think it's usually when we have 3 ailments and also we start to tax the caregiver. So the caregiver can't leave them for 8 hours, right? They have to come home in 4 to let them out. We have to wake up at night. They're starting to struggle. They have to entice them to eat more. So when you have that caregiver burden on them, that it becomes a serious issue. And so it usually starts when there's about 3 things. Because, a dog that's losing his vision, we set the house up a little bit for them and it's not so bad. Now you add incontinence. And then you add cognitive dysfunction or mobility issues. And it's really hard. And, I was talking to this woman yesterday about her dog, Louie. And Louie has a bad disease. He's got osteosarcoma, but she can't leave for a trip that she needs to go on because she can't, he's got some mobility issues now. And if that fractures, it's not good. And I said, well, he's geriatric. He has other problems and he's got a bad disease. He's in hospice. So as a clinician, usually all the ones that we see at end of life, they're geriatrics. They're, they're up there. They're the weak and the wobbly and the crusty and the lumpy and the most beautiful ones of all.
For sure. Because they're so loved.
And they've got like a whole history of story behind them. The sad thing Molly, that really upsets me is, doing end of life, everybody thinks that we must be crazy and sad, right? And so going to somebody's home to euthanize their dog or cat that's old and's got problems it doesn't make me sad. I mean, I'm sad for the family, but it doesn't break my heart, right? What breaks my heart is that so many have not been to their doctor in the year before. And I did research and I looked at 817,000 families that euthanize their pets in the United States across the whole country. And 50% of pets have not been to their doctor the year before they died. And that's what I know. And that is when they're really geriatric. In humans, it's usually, to be a broad categorization, is the last 10% of a lifespan. So if the average lifespan is, let's say, 12 years old, right? That's a year and a half, year and a half. And it's so sad. And 44% have not been to their doctor a year and a half before. So basically half. And it's not just about the blood work and x-rays and, what's the best harness to give them? What's the best, do they need a halo because they can't see anymore? How do we protect them? What about enrichment to keep their minds going? They do smell because their skin isn't so good, like I was talking about, right? So then we've got some crusties and stinkies or dandruffy and oily, like it's in between. And we could help those families so much at that last stage, even if it's not about chasing Cushings and chasing some bad stuff, just caring for these guys that, I lovingly call them jalopies, right? Like they've got a lot going on. And so that's what makes me sad is that so many have not seeked care. And a lot of people ask me, well, why do you think that is? And I think it's a myriad of reasons. I think denial is a wonderful place to be in sometimes, right? Like, I don't even want to know. Finances are another. Listen, he's a 14-year-old lab that's got a lot of issues. What is Dr. Mary going to say, right? Like, she's just going to give me the list of issues and charge me $500 to do blood work and x-rays to find that issue. Like, so I see that. And they also sometimes think, well, how much time do I have left? And they're waiting and they're waiting. And it's a waiting game because they think they're going to die in a month or two. And then they keep living because they don't. So I don't know for sure. These are just anecdotally when I hear families and they're talking to me, they're like, I know we haven't brought him in and this is why.
It's hard because it's, of course, an emotional and interpersonal conversation to have with people. And it's at a tender time
Yes,
in their life.
tender's a good word.
The last thing they need to do is feel worse about their own choices, right? So it's hard to gather that data. I'm
right.
sure.
This is not something, right? You can't get an NPS score at some of these things, right? Like you can't ask, and I never want to judge anybody, what their decisions were at all, right? And people also remember only 10% of what we say. And oftentimes I'll go to a home and they'll tell me what they think their doctor said. And then I'm like, they probably didn't diagnose, like there'll be some that say, well, he's got kidney disease. And I'm like, well, no, your doctor said that he could have kidney disease. Doesn't mean he has kidney disease, right? And we forget these things. And so you never judge, because what is that going to do? Just moving forward, how can we educate our clients more, get more information on websites? That's why I wrote my book. I just wanted more people to have the support they need during the end. Because Molly, no matter how old they are, right? When your little one is 18, it's still never long enough, right? We want them like a turtle. 20, 40 years would be great. And
100%.
It kind of drives me nuts when somebody will say a really good old age, like, oh, he's a 16-year-old lab. And people will say, oh, that's really good. Isn't that really good? And you know what? When my grandmother died, nobody said, oh, that's really good for her. For an Irish American, that's really good. Like, no, I wanted her more. So, I mean, that's the name of the book. And my cat book is coming out later. 9 lives are never enough. So
that's great. So, obviously this is Dog Cancer Answers. So this is always something that people who are coping with dog cancer, they're constantly, I think almost every day, people are looking at their dog and saying, where are we? There's a continuum, there's a spectrum, and I want to balance it. And we kind of classify people in 3 buckets. We say there are people who just want comfort at the expense of longevity. It's fine. They want longevity, but comfort is more important. There are people who are in the opposite end who longevity is really important to them for many reasons. And they are willing to tolerate some more side effects or, manage things a little bit more. And then there are people who are right in the middle who are like, don't want to go too far in either way. Like I want to strike that perfect balance. So what do you see when it comes to cancer? What's your best advice for someone whose dog has cancer?
This is so interesting, and you're spot on, Molly, because it is a rainbow of choices that we have, and I like to understand the goals that somebody has and the goals of care. I also want them to understand their budgets, which I'll talk about in a second. But is it to eke out every last moment that you have with this pet? Or is it that, I don't want him to ever be anything but he is now, right? Like I want this, I always tell families, you can have a horrible weekend and on Monday you call me and you say, I can't imagine another weekend like that. I'll support your decision to say goodbye. You could also have a phenomenal weekend and call me Monday and says, that's how I want him to go, is on that. And I support your decision to say goodbye. If at any time I've got a pet that's got 6 months or less to live, and like osteosarc is a great one to talk about, and they're in my hospice, they're a hospice patient. At any time we could say goodbye. So it is about the budgets too. Is what can they financially afford? Because there's depending on the size of the dog, the medications are different prices, right? There's
right,
and that's very important, Molly. No matter what they decide, palliative care, keeping pain away is vital. I have 2 osteosarcoma patients right now, and the one is going to do it sooner than later, and the other one wants to wait every last minute, but they're also struggling with the idea of pain management, and that because they think it's upsetting his belly. And I'm like, this cancer is upsetting. Like there's other things that's doing this, not the pain management. You must, and he has a pathological fracture. I'm like, you must give him, this is the worst painful thing. It's horrible. So anyway, back to the budgets. Then, so the financial budget, can they afford it? The time budget, it takes a lot of time with these guys. For this one, they have to harness walk him. They've got to do a lot, they have to give meds every 4 hours, whatever it may be. So do they have the time to care for that pet properly? Do they have the physical abilities? So can they give the medicine? Can they lift the dog? A Maltese is not so bad, but you talk about a Rottweiler, it's a different story. And also, a Maltese could be hard for some people. What people also don't think about is the stress that a pet puts on the home, and then the physical abilities of the owner to manage that. So I have one family that can't manage. She's an older lady herself, and she's got really bad hips. She can't clean her floor, and the dog is pooping all over the floor. Oh. Right. So now she is feeling guilty because she can't get on the floor to clean up, and she's slipping on the poop. Like and we don't ever think about these things, right? Like, right. And she physically can't keep that clean, and that's not good for anybody. And then
this is why we can never judge, right? We can't possibly judge. Like, nobody should ever judge anybody else because everybody has such specific 100%. Circumstances.
Being able to go in the homes, I've seen so much, right? Like, every one of these people love their pets, and that's no doubt. But what they can manage. And then the last budget is the emotional budget. Is this the last living link to their husband that died last year, right? Is this, which this is what one of my patients is dealing with. And I think that's why they're keeping him so long, right? Is this dog or cat the thing that got them through a divorce? Are they going through a divorce and they need this, companionship and they can't imagine giving up? Or like, did they have a dog before that had lymphoma and they felt they waited too long? So this time they want to do it sooner. And so a lot of technicians will sometimes give veterinarians a hard time because they're like, but he's still got a lot of life left in him. And why are you euthanizing? Right. And they're like, because last time they waited too long. Last time they were in the emergency clinic and they don't want that. And so it's hard for us as a whole team to see the full picture, but there is a lot. And it's a beautiful and wonderful conversation I like to have with families, to be very supportive to them, find out what are their budgets, what are their goals of care, and also what is their goal for the end. Do they want to have it in their backyard? Do they want, party? Do they want just me and them? Do they want music, not music, and making a bucket list? So we could, I love all these things, and it's just a beautiful way to honor them. And, some people have so much guilt with cancer too, because if they can't afford certain treatment options, or, they themselves have gone through chemo, so they're kind of anthropomorphizing what they went through, and and some people will say, well, it's just a dog. Why would you do chemo? And why would you do this or that? So funny, I had my own dog, Sam. She had, I thought she had degenerative myelopathy. And about 2 years ago, she started to do some wonky stuff. Long story short, she had spinal lymphoma. So just very, very, rare. But it was like a DM dog. So that was her symptoms, was, toe dragging, all weakness, whatever, incontinence. What was my point? Oh, so everyone was, they're like, okay, Mary, I went for chemo and radiation. I went for it because I'm like, you know what, if I can get some more time and I will manage her symptoms well, I could take her to chemo every week. I could take her to physical therapy 3 times a week. Thankfully, we were in COVID. We were shut down. I could actually take her, and I wasn't traveling. So this was a beautiful time. I had the time.
You had the time.
But let me tell you, in normal circumstances, her dad, he wouldn't take her. No way. And he also didn't totally agree with me. He wanted to let her go sooner than later. So that's the other problem too, Molly, is the people in the house don't always agree.
Yeah, actually, that is very true. We hear from people a lot who they say, my husband thinks that I'm being cruel, or for giving up too soon,
Either
or
way.
for keeping on. How do I talk to him? How do we get on the same page? So, Dr. Gardner.
Okay, I know it's so true, and it is like, quote, cruel either way. Like it doesn't. So what I normally do is I'll say, listen, you guys are not going to agree. and this could be kids too. A lot of times teenagers get involved and they get, they're the harder group of kids for me to handle because they have opinions. They've heard things. They're like, what do you mean we can't afford to do this? But all that stuff. So anyway, so let's just stick with the parents. But I'll say I know in advance, you guys are not going to agree down to the exact, moment, right? But what we can agree on is that we don't want Rusty to suffer, right? So that everybody says yes to this. So then I say, okay, but now what we need to come up with is what is suffering to Rusty? Because that is huge, right? So I'll give you a great example. My dog, Sam, she was fecal incontinent. And so in the middle of the night, she would poop on herself, and she was an Anatolian Shepherd. So it was all over her beautiful fur, and I had to wake up early and clean her. But I would do it. And I'm like, but otherwise, she's doing okay. She was a jalopy, but she was okay. So I was okay managing that. Her dad, he thought that was suffering. He was like, no dog should sit in their poop overnight. Not, and please know I cleaned her up as soon as I could, all that good
I
stuff.
understand.
But he was thinking to himself, he's
Right.
like, if I'm ever going to poop on myself, that's horrible, And so to him, that's suffering. To me, I'm like, I just clean her up. She doesn't care. And so you have to come together with what is suffering for Sam, for Rusty, whatever that means, because every pet is different, right? So if it's a cat that loves to lay in a sunbeam and that's like what they love to do, and now they're hiding in the closet, is that suffering? Is suffering that they can't eat for 3 days in a row, that they can't get up on their own, that they, whatever it may be. And then we say, okay, now let's draw lines in the sand. When is this going to happen? And I love quality of life discussions and quality of life scales, and having everybody do them. And respecting what everybody's decisions are and what their thoughts are. And there's usually also the primary caregiver seems to be ready for euthanasia sooner. I think they're the ones that are just managing so much. And it's not that they can't manage it, but I think they see the struggles. They see the struggles more than somebody who comes home at 7:00 at night and they're like, oh, look, he's happy to see me. He's eating. Well, you didn't see everything I just dealt with for 10 hours, right? So
That's very interesting. So basically what I heard you just say is that the best thing to do when you're on a different page than your spouse or the other humans in the house is to make sure that you can get on the same page, and the page that you should focus on is what's going on with our dog, who we all agree we love and don't want to suffer, and what is their quality of life? What do they like, and what do they dislike? And where are they?
And where are they?
In that space. Yeah.
And it's funny you say dislike too. So I had this one patient, Andy, the dog's name was Andy, and he had a disease. But when I went to go visit him the first time, he was sassy. He was just, he wouldn't let me near him. He was just like, kind of dog. And I said, you know what? Andy does not like strangers. And when Andy when Andy doesn't care anymore and he's like, yeah, you could pet me, I don't care. I was like, that's not a good sign. He's so tired. He doesn't care. Right. And so I love to write down like, what makes Andy Andy? Is it going for a walk with dad? Is it sitting on mom's lap? Is it growling at everybody who comes in the door? And just really talking about it. And having a discussion. I do believe also, Molly, that it is important to talk about the last day, the last moment, and talk about the euthanasia. So many people are scared to talk about it, but I think it's so important.
I said I wanted to talk about your apps, but before we do that, let's talk about mobility. You were talking a little bit about not being able to get up. Is there anything that you would recommend people think about when their dog starts moving, like limping or not able to get up so well? Like, if there are things that they can do or things to look for, signs to really take seriously and take to the vet?
I dedicated a whole chapter to that in the book because we see so much mobility issues in our older dogs. It's the number one, besides cancer as a disease, it's the number one ailment that we see in older dogs that we manage. And whatever the reason is, it could be a disc issue, muscle wasting, arthritis, neuropathy, or things like that. So whatever the issue is, we still have a mobility issue, and whatever the cause of it is, rather. So the other thing that I know a lot of people can understand limping and they can understand slow getting up and down, The one thing that surprises families is the toe dragging. They're like, oh, it's just getting slow. So he's dragging his toes or, flipping of the feet. But the toe drag, this scuffing of the toe, I hear it and I'm like, uh-oh, that's what triggered me with Sam. I was like, I heard it on the walk. I heard a scuff. And I'm like, that's not good. They should not be scuffing. And we see that a lot with, polyneuropathies and even some disc issues too. The messages aren't going correctly. So these are early signs. And the sooner we catch mobility issues and manage them, the better. What I don't like for people to do is just say, well, he's hurting, so let's not let him move. We got to move, right? Like we got to keep moving. We got to keep our muscles strong. We could learn from this. We got to keep muscles strong. We got to keep lymph flowing. We've got to keep all of the juices cooking. And I want them walking. We have to alter what we do for sure. We're not going to be running around playing as much, but absolutely walking. I walk 4 miles every morning with my dog. And so if you've got a dog with some ailment of mobility, break up, their walks to 3 or 4 times a day, or shorter walks. Absolutely do them. And they love it. They love walking, right? Like that's their jam. If they're
smaller walks more often.
And I don't get paid by this harness company, but my favorite harness of all times is Help 'em Up harness. It is help 'em up.
Help 'em up.
And then it go help 'em up, right? And so it's just got great support in the front and the back. And so that way you can help lift their hind end, and they've got tons of accessories. And it is my favorite. It's maybe $100 for a large dog. So it's not that bad. You can buy cheaper stuff and that's what it is. It's cheaper. But you've got to set your house up for success. And if there is a hardwood floor or a tile, that's not good. And they're going to find that spot. So you have to cover your floor in rugs and in bath mats and yoga mats, stuff like that. They need traction, because when they have traction, they're going to use their muscles. They're going to be safe. And there's a ton of other products that I talk about, that, the toe grips and what kind of booties are best, because not every booty's the best for, certain diseases, and just making sure that they can move. But we have to address pain if they are in any pain too, because we don't want to force movement if they do have pain.
Okay. So let's talk a little bit about pain. The things that people always want to know is my dog in pain?
Yeah.
And oftentimes I'm looking at the description, I'm thinking, well, it seems to me like that's pain that you're describing. But how do we know?
Yeah, a chronic pain is the harder one. The acute pain is easy to see, right? So if they broken a leg or a ligament or something like that, they're limping and their leg is up and they're like crying and whining. That's so obvious, right? But the chronic pain, we kind of get used to seeing them do certain things. So we don't notice it as much, right? And so they're just getting slow. It could be so minor, just like the sawhorse stance of their legs. They just look like they've got something going on, where they're just sitting like a sawhorse. Of course, getting up a little slower, getting down a little slower, things like that. But that is signs of pain. But they also could just be panting more. That's a huge sign of pain. They could be, pacing more. They could look anxious more. They could also show no signs. Just because a pet does not show outward signs of pain does not mean they don't have it, right? Like, nobody knows, right? Nobody would say right now, I have pain. And I absolutely do. I've got a really bad shoulder and it hurts so bad. But nobody knows because we manage it, right? Why would I complain also? Dogs and cats don't love to complain, right? Except certain breeds. Certain breeds maybe are a little bit more sensitive to stuff. The other thing that we have to, a lot of people don't realize, is something called allodynia, which means sensations and things that should not normally hurt. Because a pet is so wound up in pain, they're already in a state of pain, that these other things start to hurt. So a great example is the golden retriever with really bad arthritis, or, even osteosarc or something like that. He's got pain and nobody's noticing it, but he doesn't like to get pet anymore. And somewhere else, it could be his head, right? So allodynia lowers the threshold of where pain is. So things that normally shouldn't hurt, even like a vaccine, you give a little teeny weeny needle and they're like, ah! And it normally doesn't hurt, but because they're already in pain, their threshold is down. And I get migraines, and the light hurts me, right? Somebody touching me hurts me. So,
Yeah.
So even just signs of things that are starting to aggravate them, that probably shouldn't.
Okay. Well, that's a really helpful thing. So when my dog Rue had pretty severe arthritis at the end, and she had it for the last couple of years of her life. And she started to get really aggressive with us. And she'd always been like the most cuddly, lovely, kisses, kisses, kisses dog. And she just was getting so aggressive. And that was definitely a sign for us that she was in a lot of pain
Yes.
a lot of the time.
Yes.
And so it sounds like that's what you're talking about
Yes,
here.
100%. And so many people will say, well, it could be, right? They could be, some people will say, well, they're just getting ornery in her old age, right? Well, no, it's probably something else. They just don't get curmudgeons, right? Like not like
That's not actually a sign of aging
That's not-
to get ornery.
no, like for us, yes, right? But not for them. Like they're just awesome. And it's either pain or anxiety. And let me tell you something, anxiety is a form of pain. And so the definition of pain that is really important. Yeah, let's touch on it. So really pain is not just a sensory, it is like a physical biological thing like arthritis. It is also an emotional and social component. Anxiety is, dare I say, more painful than pain. If any of your listeners have ever been anxious over something, right, whatever it may be, like that it can make you sick, and you stress about it, and you can't even think about anything, right? So separation anxiety, when pets get older and they have separation anxiety, even, dare I say, sometimes going to the clinic, if that brings them more anxiety as they get older because they have cognitive dysfunction and things like that, we got to address this. So it's not about gorking a dog out on meds, it is about making sure that they're comfortable. And that's what palliative care is making sure they're as pain-free and anxiety-free as possible.
This show is brought to you by dogcancer.com, where over 40 veterinarians, veterinary oncologists, cancer researchers, and science writers pull together to bring you better information today so you have no regrets tomorrow. We do the research, we talk to the folks in the trenches, and sift through the hype and the anecdotes. That's dogcancer.com. Start your own research at dogcancer.com today so you have no regrets tomorrow.
So when a dog has cancer, for example, where do you start to offer, in your expert opinion, where should someone start thinking about palliative treatments as opposed to curative treatments?
Oh, this is so good.
Where do we cross that line?
Molly, this is good. Okay, so there's a difference though, because palliation should be everywhere in veterinary medicine. So palliative care is everywhere, right? So we always want to do palliative care.
Okay.
Hospice,
right?
Hospice has a component of palliative care, right? But so it's keeping a pet comfortable, as pain-free as possible, whether that is a short period of time, so maybe after a surgery that we know they're going to recover from, and we want to give them medication to make sure that they can sleep at night, they can not have pain. That's palliative care. You're trying to keep away pain and anxiety. So it could happen for a short period of time, and it could also be for the rest of their life because they have to deal with something, right? So,
okay. So if a dog has chemo or has a surgery, and then they're prescribed Serenia, for example, as just one, right, to try to keep nausea at bay and keep them comfortable, and they're prescribed pain medications after a surgery to give routinely for a few days after the surgery. Those are palliative care steps because you don't need the pain medication in order to heal from the surgery.
Right. But, there's a lot. Yes. Okay. There's a lot of studies, though, that show when you are painful, you actually heal slower, right? Your body's, So I see, and that's in human medicine too.
Right.
And it drives me nuts when people don't give the meds. And let me tell you, nausea, that's the worst. I don't want ever to be nauseous, right?
I agree.
I'll take a broken toe over nausea any day. So I love Serenia, and I prophylactically give it, right? Like just give it because they may have it, because I don't. It's much easier to keep pain away than chase it away.
Okay.
Right? Like once you start having it, it is really hard. So some people say, well, he's having a good day, so I'm not going to give it. Please just give it, right? Because he's not telling you also, right?
Okay. So that I think that's really important advice. I'm just going to highlight and repeat what you just said, which is that sometimes we think, oh, I don't want to give too many drugs. So I'm not going to give the anti-nausea or the pain medication today. But your advice is to give it because it's better to give it when he doesn't need it as much, but still needs it a little, than to not give it at all. And isn't there a cycle that can start, like pain begets pain in the body?
That's like the wind-up comment I made earlier. So pain begets pain, and you also then have a harder time getting it down. So like sometimes we have to give multiple drugs. Once they're in such a state of pain, we have to give so much more to get them to lower that threshold so that way they feel a little bit better. And it is true. When I start to feel, sick and nauseous, then everything starts to escalate. And I know so many people are scared of giving some drugs, but if it was you, you'd probably take them. The dog or cat's just not complaining. And some people don't take drugs. They're like, no, I'm not going to take the Tylenol, even though I've got, a bone sticking out of my leg, and they need more than a Tylenol, but they don't even want to take that. Right. And I'm like, oh, don't be tough. This isn't the time to be tough. And you mentioned something earlier. I forget how you said it, but it was wonderful about sometimes we may not be doing curative treatment, and that will shorten their lifespan. That like they won't live as long. But what I want to make sure is that when they do live, they live well. I don't want to extend life if it's not well. And that's not the goal of hospice. That's not the goal of what I do. It is about, even if I've got 4 days left, I want them to be good.
I think everybody wants that for their dog.
Exactly.
I think they want them to be happy and healthy and vibrant and vital.
Yes.
Right up until the day that they, for some crazy reason, have to leave us.
I
and
know.
why do they have to do that?
I always say we just borrow them for a little bit. We got to give them back.
What do you recommend people look for in that? So your overall point was palliative care happens all the time. That's not something that is just for end of life. So at what point when we're looking at curing a condition like a cancer, and we're really hoping that the dog will go into remission, or the surgery will work and the tumor will reduce and then we won't find metastasis, or we'll slow the growth, we'll stop the spread, and we'll be able to stabilize the illness, whatever the goal is in terms of curing the cancer. At what point do you look at a picture and say, well, that's not going as well as we hoped, and it's time to really focus on that end of life phase, that hospice
phase? Yeah. So I love working with the oncologists and general practitioners too, because we do know that there's not every dog and not every disease follows the book, right? So we know that, and also when we catch it, because we say, let's say for a quick example, osteosarcoma, 6 months. Well, what if we caught it at month 5, right? Like, we don't know really. And maybe it's actually longer than 6 months, but we only catch it at month 2, right? So we don't know where we are. But I think when it's good to know that, hey, our chances of curing this is 90%. But we got to plan for that 10%. And when we see the signs, like it's not going well, we start to see the spread if it's in their lungs. And I'm not here to stop with hospice. If they want to keep trying some things, I'm okay with that. But I want to make sure we are also at the same time talking about bucket lists, quality of life conversations, all of these things. And that Doberman that has the pathologic fracture with his osteosarc, I mean, they were asking me about immunotherapy and like things like that. And I'm looking at this dog, and he's cachexic, body condition score is like horrible. So he's just all like muscle wasted. And I wouldn't even suggest amputation, even though I'm pro amputation if we caught it 4 months ago, not now. So depending on where they are too within that, is the curing really, how are the odds stacked against us? There's nothing wrong with planning.
Yeah, there's nothing wrong with planning. I guess that's what my question is. Sometimes I get the feeling, not from my vets, but from people that, we run Facebook groups and for dogs with people whose dogs have cancer. And sometimes I get the feeling that their vets are not willing to talk as clearly as you are, or that they think that's true. Do you think it would help people if vets really laid it out and sort of talked about ramping up palliative care while tapering down treatment care a little bit more clearly?
You know, I think this goes on both sides. There are some vets that don't like to talk about this, or they're just not as good. Listen, I can't do surgery. I can have this conversation all day long, right? But I don't bring me in the surgery suite.
Right.
So there are some things that we're better skilled at. Just like there's some people who don't want to talk about this. And I will get the stink eye, Molly, from people like, don't you talk to me about end of life? Don't you talk to me about hospice? They're, they've got one foot on denial island and that's okay. So it's both camps need a little bit of work and need a little flexibility with this, right? So, but I travel and speak at conferences all over the country on managing the geriatric pet, having these conversations, goals of care and things like that. And vets are trying to learn it, but you said it great. This is such a tender moment. And it is very hard because no one wants to deliver bad news. No one does.
Right.
And believe it or not, people think I have a hard time being a hospice vet. And I'm like, no, I'm not the one that delivered the news. Like, you guys have it harder. You GPs have it harder. You're the ones that are delivering it. I'm not. I'm here. I'm the angel. People love me, right? But they have to get to this point.
You're the one who steps in.
I'm right. They've called me angel a number of times. I'm like, I'm not really that good, but okay. So, but I think it was so helpful for this family. I'm helping this osteosarcoma dog, and the husband and wife do not agree. The mom wants to keep going, and the husband, he's never been through end of life before. This is her 6th time. He's at different stages, and he said, "I'm so glad that you just went over these things. I just wanted to talk about them. I'm going to put them away on the shelf now. I don't want to talk about them again, but I'm glad that we went over it." And I think nobody wants to feel like they're giving up, and no vet wants to appear like they're giving up. On both, so the owner doesn't want to look like they're giving up. Right. The vet doesn't want to look like they're giving up. But preparing for the end is not giving up. It's going to happen. It's the crappy part of life is that we are not here forever, and it is actually worse if we don't talk about it. And patients that enter hospice and get palliative care sooner than later actually do live longer and live better. So don't wait into the end. My uncle last year, he passed. He had prostate cancer that spread to his bones. And I'm in the hospital with them, with the human doctors. And I said, he needs to go to hospice. And they're like, no, we're going to do radiation. And I'm looking at him. If he was a Jack Russell, instantly I would be ready to say goodbye to him. Like it was so bad. And it broke my heart because he was so painful and nauseous and oral ulcers, all these things. And the human doctors were not ready to say it. And I was so mad because I knew if he got to hospice, the mindset would be different. He would be focusing on other things. And they brought him to hospice on Sunday morning. Monday, we had to just load him up with morphine, and he died Monday night. And it bothered me because I know we could have brought him there sooner and had so much better quality of time with him. The quality of time was horrible. We were just fighting the hospital. And it was not about giving up, but I think too many people still think it is.
I have a neighbor who had metastatic breast cancer, and she went into hospice. The doctor said you have at most a month, and she lived almost 3 years in hospice.
I love it.
Yeah. I wonder, I've never thought of this before, but I wonder if you would agree with this. Would it be useful for people whose dogs have cancer when they get that initial diagnosis to start talking about hospice care right up front and sort of think of it as something we're going to start with? We're going to start here with palliative care that will increase probably over the course of this illness, and it's just part of the process. It's not something. It doesn't mean you're not doing the curative at the same time, but you think of that, maybe of that Serenia that you get with the chemo treatment as part of hospice care, so that you can get used to the idea.
I think it's so good,
and maybe even get more longevity.
100%. Especially for those
you're focusing on quality of life.
You're focusing on quality of life, particularly for the ones that we know there's no cure for, right? Like this is not a benign mass that we're going to remove and he's going to be fine afterwards, right? Or after pathology that we find that it's benign, then it's metastatic or something like that. 100%. Even if we don't have to say we're in hospice just yet, Let's talk about it and say, okay, when we are at this point, we're going to start hospice care. We're going to call the doctor to come to the house. We're going to have the technician come to the house and teach us things. We're going to there is nothing wrong with that. And I have had, by the way, a few hospice failures, meaning they've been in my hospice care and I kicked them out because they started doing better. Andy, that dog I was telling you about, started doing better. And I didn't euthanize him for another 2 years, which is great. It's almost like your neighbor. And that's okay. Like, it's okay. And we're not doing anything bad. We're not making things go faster.
Right.
We're just making sure what is time we have is better.
Hospice is not making things go faster. It's just focusing on quality
100%.
of life, making sure that things are better.
You like it?
Love it.
Good.
Love it. Yeah. You said something on another podcast. We suffer so they don't. What is that? Can you say a little bit about that?
Something I came up with because I see families emotionally suffering during this end, right? It's horrible. And no one ever wants their pet to suffer. If I asked 100 people, nobody would say, yes, I'd like my pet to suffer. Nobody does, right? And a lot of times when we're at the end, pets may be actively suffering, and I don't like that. But sometimes they're just struggling. They're really hard. They're struggling. And I say to owners, he's struggling, but we don't ever want him to suffer. So that's why we're doing this, is so he doesn't suffer. And sometimes we have to suffer so they do not. And that suffering means saying goodbye sooner than we ever want to. It will always be too soon until it's too late. And what I don't want to do is have any regrets. I'm very worried about this dog that's in my hospice care. I don't want them running to the emergency clinic at 2 a.m. and not giving this dog a really beautiful, peaceful goodbye. I'm very worried about that. And but I also understand. I understand how hard it is. I understand that I get it. I let go of my girl Sam, and it was I ugly cried. I cried the house down. Like, it was horrible, and I suffered. But I knew she was okay. I went to one of my dogs I let go about 10 years ago. I went to a pet loss support group afterwards, and because I really wanted to experience what a pet loss support group was like. I'd never gone to one, and I send people all the time, and I think it's very good to manage. And at Lap of Love, we have a support group that's free to families. And I just wanted to understand the process. Anyway, so I went there, and this woman has been going for a year to this pet loss group. And it's however long people need, right? No days, 100 days, 30, 300 days.
Right.
So they said, so Mary, share your story. And I said, well, my girl, she had Cushing's and diabetes and all these things. And I said, I let her go on a good day. And the woman across the circle, she's like, you stole good days from your dog? She was serious about this. And I'm like, oh. And so I said, yes, I did. I know Sarissa had some more good days. I said, but what I also know is that I stole bad days. And that is what I'm going to pillow my head at night, knowing that she never had to have those bad days again. And it sucks that I lost those good ones, yes. But I know I would never let her suffer. And so I'm the one that's suffering, so she never had to. That's what that means.
That is very powerful.
Oh.
That's everybody loves their dog. And I wouldn't say anybody's act is more loving than another, but I think that being willing to take on that burden of knowing that it was, quote, too soon is a real act of love. It really
is. I am very supportive of those families that want to do it sooner than later. And I've been criticized actually by some veterinarians. They're like, he's having such a good day. And I'm like, yes, but it's okay to say goodbye on a good day. And that's okay. It's been 12 years in the making for me to get to this point. Right. And, but it's okay. And about 5 years ago, I became a vegan because I couldn't the concept of this, of healthy animals for my food. It just made me all wonky. So here I am, a little wonky, Molly, like all of us.
Right. So you have some tools that you recommend. The Pet Hospice Journal is one, and the Gray Muzzle app.
Yeah. So about maybe back in 2013, we have a number of quality of life scales available on our website, Lap of Love, and you could just search Google quality of life scale, and you'll have tons. The Ohio State has one. Dr. Villalobos has one. Anyway, so, but I really I'm a bit of a nerd. So I was, I worked actually in software for 10 years before I became a vet. And so I've got this little techie background.
Okay.
And so I built a little website called the Pet Hospice Journal. And it just it's just a digital way to monitor your pet. We also built an app a few years ago. And that's just simply good day, bad day, neutral day. And tracking this. Because everybody, Molly, will say, oh, when he has more bad days than good, it's time, right? Well, guess what? What you do is they have 3 bad days in a row and then they have one good day and you forget all those 3 bad days because you had one good day, right? So
say, I'm so glad the bad days are over.
We're over that. And they're like, forget about it, right? So you've got to monitor what you're measuring.
Right.
And so whether it's my app, whether I have a journal that I also made that's a companion to my book that's got symptom tracking, cognitive questions, mobility things, quality of life, bucket list, all these tools that just can be so helpful. And it's not for everybody, but I think it is actually really helpful to write things down, diary, journal, and create goals of care and things like that. So I got a whole bunch of tools in my toolbox. What anybody wants, I got. Or it's just a conversation.
Well, we'll
right?
put links to all of them in the show notes.
Perfect.
Yeah. Well, is there any last thing you want to impart to our listeners about what they really would, if you could sort of wave a magic wand, what's the mindset that you would implant in their brains when it comes to dogs, hospice, end of life, geriatric care?
Gosh, I know. My thing is say I love you every day. That is the prescription I prescribe to every pet family, right? Like literally say it, because we will, when the time comes, we will always wish we had one more time to say that. We'll always wish we had one more picture, one more video, like go nuts, use up your phone, like go through all the memory you've got and say, I love you, because if you are not present and you do not, and they die on their own, you have not said it. And I think it is really important to verbalize that every single day. And a lot of people say, I do that all the time. Make time. 15 minutes with nothing else. You just sit there and lay with them and say how much they meant. Just hold their paw and just say how much you love them.
Beautiful. Thank you so much for joining us today.
Oh, thank you.
Dr. Mary Gardner.
Thank you. I hope this is helpful for everyone.
Hoping for a regular dose of hope along with the latest information on dog cancer? Subscribe to our email newsletter, Dog Cancer News, at dogcancernews.com. Each week, we send support, guidance, hope, and information via email to dog lovers just like you. We know what it's like to have a dog with cancer. So join us and subscribe to Dog Cancer News at dogcancernews.com.
Thank you for listening to Dog Cancer Answers. If you'd like to connect, please visit our website at dogcancer.com or call our listener line at 808-868-3200. And here's a friendly reminder that you probably already know. This podcast is provided for informational and educational purposes only. It's not meant to take the place of the advice you receive from your dog's veterinarian. Only veterinarians who examine your dog can give you veterinary advice or diagnose your dog's medical condition. Your reliance on the information you hear on this podcast is solely at your own risk. If your dog has a specific health problem, contact your veterinarian. Also, please keep in mind that veterinary information can change rapidly. Therefore, some information may be out of date. Dog Cancer Answers is a presentation of Maui Media in association with Dog Podcast Network.